Hi, everyone. Welcome to Authenticity with Alicia, the podcast where we explore burnout, the pressures of society, and our quest for identity and authenticity. I'm Alicia, and today we're joined by Rayni Collins. She's a therapist and mental health advocate based in South Carolina, and she specializes in sleep, which I was just telling her selfishly, I am super excited for own personal reasons. Thank you so much for being here, Rayni.
I'm happy and excited to be here too.
So I don't know why I do this, but I always do like a little family tree of like how I know people. And I've had the privilege of getting to know you from a marketing course that we've taken. And so I've gotten to see your website and the media that you do and just all of this amazing work that you put out there to really like raise awareness on sleep and other mental health related things. So I'm just like super stoked to have you here.
Yeah, so you've gotten to see how I've grown and developed, and I'm continuing to clarify what is it that I'm doing and making sure I'm doing it the best way I can.
Welcome to like every therapist or like the things they
Yes,
don't teach you in grad school where it's like, oh,
of
I
course.
finally got it caught up. I can cross it off my to-do list. And then, oh, no,
No,
I'm gonna just
no.
keep that going.
Forever evolving. Yes.
Literally. So I know a little bit about sleep as a mental health, therapist. We know a little bit about the importance of sleep, but I think it's one of those things where like we know it's important, but then we like it's fine, it's whatever, like it's and then kind of like shrug it off, or at least me and my family do. So can
Mhm.
you explain, because this is one of the areas like this is your jam, why the heck is sleep so important?
So, in a short nutshell version, it affects everything. Like, I don't think people register that we can go longer with water and food than we can sleep. By the 24-hour mark, we are almost walking around drunk, being sleep deprived if we've
Wow.
gone without it. So it just, everything from our immune system, our heart rate, our cardiovascular system out from our heart, our the way we think, and especially our emotions. Actually, the American Psychological Association has discovered that even after one poor night of sleep, anxiety is higher by 30%. That's significant.
Wow.
So if one night of sleep does that over time, if that continues to unfold just on the emotional side, just imagine if that 30% also applies to every other system in your body and
Yeah.
your overall functioning.
Yeah.
We don't work. We just don't work that well without
Like literally, like
sleep.
our bodies are not functioning. Like I'm hearing,
No.
the emotional side, and then that's where I've dealt with insomnia for most of my life. Mine's a very like anxiety based, and so yeah, I can totally tell. Like if I'm not getting my good sleep, the next day I'm irritable and tired and anxious, and I'm not my best self. And that's
Mm-mm.
just like I said, the emotional piece of it. There's also, we're not thinking clearly. Concentration can be hard. If we have, cognitive task at work we have to do, that's going to take longer or be more difficult. The physical health stuff you were mentioning, our blood pressure, our heart rate, cardiovascular things, like everything.
Everything, everything. Like even if, of course, we encounter people that are trying to regulate hormones, or having hormonal issues, or maybe even having issues with metabolism, such as losing weight or trying to build muscle. Sleep can be a big factor in that. Um, so everything goes back to sleep.
Literally, literally. Oh my goodness. So I know you're a therapist. And so when people come to you, do they often come to you for sleep? Or because I know you said like you start working with sleep stuff pretty early in the work that you do with folks. So do they come to you for that? Or are they like, hey, I'm anxious and I have racing thoughts, and you're like, let's sneak in some sleep
Yeah.
stuff.
Yeah. I will say it's very rare that someone comes to me. They're like, "Oh, I want to work on my sleep. Then let's work on my anxiety and
Yeah.
depression." Like, it is very rare. There are some people that do come and they acknowledge it, like, "Hey, I've been struggling for a long time," and more than likely they have the like true clinical level of insomnia, and they are ready to do the work in
Mm.
regards to doing and making the changes necessary for their sleep. For the people that may not be the severe level of insomnia, but maybe have some mild sleep issues, which usually everybody does. If someone has anxiety, depression, other emotional processing or regulation issues, their sleep is being impacted. It's usually the first thing that gets
Mm,
impacted. So again, that's why I go to it first. And we may take like one session or maybe up to six, depending on how much we need to address their sleep,
mhm.
but at least want to improve it, even if it's just a little bit, to set the foundation for us to transition into more of the therapy work. Because that way their brains and their bodies are more open to receiving the information or doing the deep work that therapy entails. And more than likely, they have already noticed their anxiety and depression go lower when their sleep has gotten better.
Oh, wow.
So I'm all about efficiency. And that to me means we're working efficiently. If you're sleeping better, your anxiety and depression's lower, then when we transition into therapy, it's going to get even less, or you're going to be able to learn to manage it
Yeah.
easier, not easy, but easier
Right.
in the long term. So hopefully you're in therapy for a shorter period of time. Um, is it okay if I share an example of a client?
Yeah,
Okay, of course,
obviously
to
knowing
hide
the
it.
de-identifying info, but yeah, let's hear it.
Yes, of course. So this is like a prime example as to why I focus on sleep first. So there's one client I started where I was working with for 2 years. They had come in struggling to function, they couldn't even keep a job because of their poor functioning,
Mm,
with attention, with anxiety, severe depression. At the beginning, they also had trauma mixed in there as well. So we started addressing those things, of course, touching on sleep every once in a while, but about the 2 year mark, because of some complaints that had come up, I was like, we need to focus on your sleep. We really
mm,
need to hone in on it and see how much that's going to help with, how you're thinking. So helping you that, also helping you to regulate, helping you also to hopefully avoid some health issues
mm, mm.
in the long term. So we I did started the sleep protocol, which is doing a sleep log,
Mm,
which they were so poor functioning, it was hard for them to even remember to do the sleep log. They
mm,
wanted to,
mhm,
motivation was there, but they couldn't get themselves to do it.
mhm.
So I did a loose version of collecting their sleep diary, giving them a prescribed sleep time. 2 weeks later, they came back and they're like, I was naturally waking up around the same time every
Mm.
morning. And now I feel better. Like
Ugh,
I'm actually able to socialize. Everyone, my family and my friends are noticing that I have more energy and I'm more
mhm.
engaged. Um, and they were able to get more tasks done.
Wow.
And that was within 2 weeks. But that, I think, for that person having the foundation of the relationship, them trusting me
Mm.
and taking my, my guidance and prescribing a sleep time that was tough for them to abide by.
Yeah.
Um, they were able to do it and came back and felt better, and they've continued on since then, which actually, so that to me accelerated the work.
Yeah.
Yes, we did the 2 years of work, but it makes me question, wonder if we had done sleep before, if that, how much that would have helped
Mhm.
them in the progress of it.
Yeah.
So that's a prime example as to why let's
Literally.
maybe cut that time in half at least,
Yeah.
by let's get the sleep in a better place in the beginning.
Oh my gosh. No, that's a great example. And like you said, like with this person, of course, we can always go to like these what ifs of, oh, what if I would do
Yeah,
this
true,
first? But
true.
some people need that relationship first. Cause I know like I like behavioral stuff in my therapy too. And some people are like, they roll their eyes at me like that's never gonna work. But then if they trust you, right? And they're like,
Mhm.
okay, Rainey, I'll set myself a bedtime, and they
Yes.
do it. And they're like,
Yes.
okay, I trust her. She's hasn't let me down so far. Let me try this silly little thing. And then it's like
Mhm.
my clients always then begrudgingly come to me and they're like, I wasn't sure
Uh-huh.
about this one, Alicia. And they're like, but it worked.
Yes, exactly. Absolutely.
So
It
it sounds
happens
like
like
if
that.
you can start there, that's a wonderful space to build the foundation, address some of those things. So, like you said, they almost like their full brain and body are going to be able to then attune to that deeper, maybe more like lasting work, but sometimes I always tell people
Mm-hmm.
like sometimes we need the band-aids though. Like as much as I love like a motivated client who's like, I want to go tackle my childhood trauma and do all this deep stuff. I'm like, okay, but like are all the fires put out first? Like
Yeah.
we need to kind of like make sure we've got our basic needs. And I'm like, are we
Mm-hmm.
drinking water, eating food, getting sleep? And they're like, but that doesn't relate to my trauma. And I'm like, we need a foundation
Yes, it
first.
does. Yes.
So I love that. And I love what you're saying of like the efficiency too, of like that mind, body, spirit, that holistic connection, and just like truly just meeting clients where they're at so that the treatment can be truly helpful and transforming.
Yeah, yeah, definitely. Because sometimes I feel like, I am the bearer of bad news. I'm like, oh, you got to change that. Oh, you're not going to be able to, do that. But it's because of this good reason.
Yeah.
Um, but what was the point I was going to make? Where'd it go? Talking about relationship and the efficiency. Well, this is where, oh, that's what I was going to say. It's like I weave it back in. I don't force anybody. If nobody's wanting to abide by bedtime or wake up time, like, I'm not your parent. I'm not your mom, not your dad. But okay, listen, let me give you some information, some tidbits,
Yeah.
and if you're gonna change them or add them in, great, wonderful. You got some better sleep, great. If you don't want to go there, but you have it to kind of go back to. And I always make sure to check in because
Mhm.
sleep changes over the course of our life, it just like so it's always good to check in about it.
Yeah, I like that. And yeah, not like forcing. I think that's a good reminder of like, you're not going to force anyone these things. I think sometimes people like immediately have their guards up then. And, a lot of
Mm-hmm.
us, we function on these patterns. Like, function doesn't always mean like we're doing great. It means we know how to survive. And so
Mm-hmm.
that sleep may be serving a function for some people or like that lack of great sleep. And so it can be scary though, that like baseline's like, no, 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 don't make these big changes. And it's like, okay, like you're gonna go gentle, you're gonna check in, you're gonna give them the choice of like making like what is gonna be best for them. Um,
Mm-hmm.
I love all of
Absolutely.
that. What are some like common like sleep issues that people can look out for? Because I mean, like it's just said, like it's not often that people are coming to you for the sleep stuff. I mean, like I said, if they have that awareness and they've been dealing with it for a while, what are some of those maybe more subtle things that people can look out for where it's like, this might not be the most normal sleep thing for me?
Well, I will say what really stands out to me a lot more these days are these societal norms that people don't realize how much it impacts sleep.
Mm,
Um, for example, like caffeine and alcohol are huge things in our that are just daily norms for everyone. And I'm not anti caffeine, I'm not anti alcohol at all, but it's about timing. It's
yeah,
about just being able to register. Like, if you have that caffeine drink after 12 p.m., you know, just realize, that caffeine is still going to stay in your system and it's probably going to affect your sleeping.
yeah.
If you have that nightcap, that alcoholic drink a couple hours before sleep, it may help you initially fall into sleep, but it really wrecks your sleep architecture throughout the night,
Yeah.
unfortunately. So it's about, maybe pushing it forward a little bit more, of maybe at least allowing a 4 hour gap of when you last have a drink of alcohol and then when you're planning to go to sleep.
Yeah.
Um, I think another very common thing is uh, the sleep revenge or revenge bedtime of
Yes.
a very common thing. And what if people don't understand what that is when people stay up later than they intend to, or stay up later because they're trying to get the time to themselves, especially if they're mom and they're not able to get a lot of time during the day, or if they are just a hardworking individual that works long hours, long days, that they're trying to pack in some time to do whatever it is, check out, watch TV, scroll
Mhm.
on their phone, do whatever it is, which I think we all need that time.
Mhm.
And what I try to help people to do is find those chunks of time in the day. Find a 5 minute time throughout the day to decompress, take some
Mhm.
breaths, do the scrolling that you want to do. Um, little bits throughout the day versus trying to pack it all in at the end of the day, staying up later, and then struggling to get out of bed the next morning, and then struggling the next day.
Yeah, just that whole
So
like ripple effect that it can have.
absolutely, yeah.
Something that I'm noticing, hearing you talk is you're not like I mean, well, first of all, you're a therapist. You're not gonna like take things away from people anyway, but you're not telling people stop drinking coffee, stop having alcohol, stop doom scrolling. But you're helping people be more intentional about those things. You're giving people information. So it's like, hey, if you want a nice little like glass of wine with your family, before well, dinner, like that's fine. Maybe, have it right when you have dinner instead of maybe right when you guys are watching like your nighttime show. If you want your
Mm-hmm.
coffee, I'm never going to give up my coffee, but okay, I need to
Me
be
either.
mindful of when am I having it. I recommend doom scrolling for a lot of my busy moms sometimes. And like that can be a great distraction if you
Yeah.
are mindful and intentional about it rather than just passively scrolling while you're in bed and now suddenly it's 2 o'clock in the morning and you have to be up in 4 hours. Like
Exactly.
that's very
Yeah. Losing track of
different.
time.
Yeah. So I just
Mm-hmm.
love that approach that you're taking. And I think it helps people build that awareness so they can still get those things met, but it really like, just works for them a lot better.
Yeah. I will say that there's this um one of the most significant shifts that I noticed for people in giving this information, because knowledge is power, and I'm giving them the power to realize that if they make the choice, whatever choice that is, such as drinking the caffeine late, drinking the alcohol
Yeah.
late, doom scrolling, binge watching late at night, that their choice is going to impact their sleep and that they are going to have, it's going to be harder to wake up in the morning. And that shift of like, oh, they have that control and realizing, oh, I'm consciously making this choice and it's going to wreck my sleep. All right. There's some ownership and accountability that takes place there.
Yeah.
So yeah, that's always an interesting shift that I see in people when we address that.
I love it. Language is such an important thing for me. So I think that that's like it's a subtle thing of like, well, I'm choosing to do this rather than like, oh, this sleep stuff is happening to me. Where it's
Uh-huh.
like
Yep.
there are elements of that, right? Like I know there can
Yes.
be true, genetic things and biological factors that are in play, but a lot of it can be things that we can be mindful of and make some changes for. And that is a huge, yeah, that ownership piece. That's very huge.
Yep.
I love it. Are there like, I know like you don't want to like give all your secrets away, but are there any like go-to tips that you like really recommend folks who are struggling with sleep stuff?
Uh, I guess the one thing that I always go back to, it is like the number one tip to me is committing to a wake up time.
Hmm.
Um, and committing to that wake up time, no matter what day it is, whether it's a work day, whether it's a weekend, whether it's vacation. Because if you commit, that's the only thing you can control.
Hmm.
So you can't always control when you go to sleep. You can do all the things, cutting off caffeine at 12 or cutting off alcohol 4 hours before bedtime, not doom scrolling late. You can do all the right things the day before, but that doesn't always equal an easy going to sleep
Yeah.
and staying asleep throughout the night. Can't always control that, but you can always control when you wake up.
Hmm.
And if you do that, if you set that consistently, you're training your body to be able to hopefully wake up as naturally as possible at that time. And also, as soon as you wake up, you're starting to build up sleep pressure. It's called
Hmm.
adenosine, is the chemical in the brain. But you're building up that sleep pressure as soon as your eyes open or as soon as you're awake, whether you have your
Mhm.
eyes open or not. But as soon as you wake up, that's starting to build up throughout the day. And you want to build up as much as possible so that by the time you get to the bedtime or, at a time you're starting to like, you barely keep your eyes open, that you're going to fall asleep easier and you're going to sleep throughout the night.
That
And
makes
then that sleep pressure balloon starts to deflate back to zero and then starts again. So that is
sense.
like my number one go to commit to a wake up time. It's going to be
Yeah.
the best thing in setting a routine and a habit.
That makes so much, and like you said, like it's something that people have control over. Like something that I do a lot in my work with, burnout and trauma and, a lot of these things where we aren't always in control of these forces around us. So it's like, well, what are the smallest things that we do have
Yes.
control over? And it's empowering. And so it's like you said, a wake up time. We can do all the things correctly and we might not fall asleep at that ideal time. What do we do have control over then?
Yeah.
That wake up time. I'm not an alarm person though, so I love that advice. I'm not gonna go back to setting an alarm, but I have like a range of around when I wake up. So in my head, I'm hearing that as a win, but please don't tell me
Yes.
if it's wrong.
It, no, I will not. Actually, I think that it's about, I definitely like to help people find what works for them. And if a range works for you of, waking up no later than this time, going to bed no later than this time, if it works, it works. I'm not going to knock it.
I was like, please don't make me go back to those alarm days. It did not work for my brain. But I'm like, I'm up between like 8 and 8:30 every day.
Oh, that's great. That's a good window. I would say
Okay,
no, no longer than an hour. An hour, after an hour, that throws you into the social jet lag time, and that's not good for anybody.
that
So
makes
yeah, 30-minute window is like pretty
okay.
awesome.
Okay. I was getting
Yeah.
nervous for a second. I was like, I love the tip. I'm gonna like steal that tip for my clients. I don't know if that's gonna be one that I apply, but okay. Okay. No, I
Yeah,
can take it.
that works.
This is not even one of the questions that I have, but as we're talking, and especially with that, I love that analogy of like that, we're hopefully, building up this tiredness, this chemical in our brain that's, helping us be sleepy. How
Hmm.
do naps impact that?
So that is going to deflate the balloon a little bit. Um, However, napping is okay. Napping is not so here's my caveat to that. So napping is okay as long as it is before 4 p.m.
Mm,
and it's no longer, and this I think can vary depending on the age of the person, depending on
fair.
their needs. Because if they have medical issues or if they have chronic pain, they may need to take longer naps.
Mhm.
But if we are looking at a typical normal adult individual, 20 minutes. That should be enough to get a second wind,
Mm,
to recharge a little bit, to then carry on throughout the day,
yeah.
so that it doesn't deflate that window or deflate that balloon too
Mm,
much, and that gives enough time before that 4 p.m. cutoff time. That gives enough time for the balloon to expand some more
yeah.
and build up that sleep pressure again.
I
So
like that. Yeah, I think that's kind of similar with some of the stuff that I've read and I've recommended for folks of like, one, if you need it, like listen to your body.
yes.
But again, it's how do we meet that need while also being mindful and intentional about it. So, okay, maybe before 4 o'clock, so that after 4 p.m., you're really like working towards being sleepy and really
Yes.
being able to do that. Limiting
Mhm.
that time. So, again, being mindful and intentional, not just passively being like, oh, there goes, 3 hours.
Uh-huh.
Oopsie. But okay, can I do, 15, 20 minutes more if I have medical needs that would attend to that? But again, it's just being mindful and intentional
Mhm.
about those things that people need.
Exactly.
I love it.
Yeah.
I love it. Let's see. I have like a ton of questions, not a ton, but I'm like, I think we covered most of them. One thing that I wanted to talk a little bit about too, that's not necessarily fully related to sleep, is something that on your website it stands out is you take a holistic approach. So is that just with the sleep stuff, or what does the holistic approach look like in therapy with you?
Uh, I would say my holistic approach is realizing that, of course, our body is not just, it's many systems that work together as one.
Mm,
And in that same vein, we as individuals need teams around us. I think we need multiple people. So we need, others to turn to. So while, yes, I'm going to help with the mind and how that mind and body,
mhm.
um, more times than not, people have other things going on that they need to make sure that they have a really good PCP, they have a good chiropractor. Maybe they need to check in with a neurologist. Maybe they need to see an acupuncturist. Um, so making sure that they're not just relying on one thing, but they are setting up a system in
Yeah,
place that helps them with all the different aspects of what their body is in need of.
yeah.
Um, So that's my take on the holistic
I love
approach.
it though, because yeah, I mean, like we've talked about, we know as mental health professionals how our mental health and physical health are related. And that's only just like two of the areas of us. I mean, we're embedded in so many different systems and things that impact all of us. And it's like, I love that shift that I think we're seeing more of this collaboration because I feel like before therapists were like, we have to wear all the hats. We are case
Mhm.
managers, therapists, like we're going to their schools, like we felt like we had to do all these things. And now we're
Yeah.
like, here are my lanes, and let's find other amazing people that can
Hmm.
support you. Like it also
Yep.
builds that community for that person who then they're like, oh, I have an amazing therapist and a great chiropractor and these other people who all want me to do well and are helping
Yeah.
different things that they are specializing in. Like I like that. It's freeing for us. I'm like, I don't want to do all the things. I didn't go to med
Absolutely.
school. I don't want to go
Uh-uh.
deal with any of that stuff.
No, because when I meet someone, and even with people that I've worked, there's ongoing work, I question it. I always question, like, is there something else also going on here? Are they making sure that their hormones are
Mhm.
regulated? Are they making sure that they're eating a proper diet for their specific body's needs?
Mhm.
That's not my realm. Like,
Right.
I
On my
need you
pay
to have
grade.
my team. Yeah, exactly. Like, I need you. Let's bring somebody else in this team to help you get
Mhm.
healthy and happy,
Yeah.
and within yourself and in your life.
Yeah. And again, it makes me think back to kind of where we started this conversation of that's going to help the efficiency of treatment. Like if we
Yeah.
can attend to all these different systems, that's going to fill up our cup. That's going to be able to like if one of these major areas in our life is being impacted, that's going to have a ripple effect on those other things. So if we can find a team, a unit, a support care system, then that allows you to do the therapy, the deep work that you are trained and like excited to do with these people.
Yeah. Exactly.
Ugh, I love it. So all in all, sleep is important. We knew this. We got to do it though. We got to get
Yeah.
the sleep.
Yep. Absolutely.
But taking the snippets away though, and like small doses, like it's okay to make those small
Hmm.
changes. Small changes are really powerful still. So it doesn't have to
Hmm.
be like super rigid or scary or structured. Like they can do it in a way that makes sense for them.
Hmm. Yeah. And just be gentle with yourself as you're doing it. Absolutely.
Yep. And I always like to remind folks, I compare us to toddlers a lot. I'm like, toddler, when you set bedtimes with toddlers, do they immediately like love bedtime? No. Do they benefit from sleep routines? And like, is it good for their brains and their body? Yes. Are they going to cry sometimes and like push boundaries? Also, yes. Like, we are the same.
Yes, absolutely. Like, I actually came across a recent research study that just reinforced the fact that bedtime routines not only work for children, but they also work for adolescents and they work for adults. I don't think it should take a scientific study to prove that, but hey, everybody needs, proof that
Yeah.
things work. Well, I think we don't need it, but there it is.
I will take it. I'll take it. Well, folks, make sure to go check out Rayni. I'm going to drop her website. She's on social media. So follow along if you want to work with her and learn other sleep tips. She does different just graphics and videos and gives all sorts of great information on this topic. I always like to end with how have you been practicing authenticity lately?
Lately, I would say that I'm making sure to be mindful of who and where I show up.
Mm,
So I make sure that I am in place, a space around people that I can be myself and I can let my nerves drop down, that I don't need to be nervous. And that's more of like some reassurance on my side. So I'm just really, really mindful of where my energy goes and how I
yeah.
spend it.
Yeah. I like that. Again, it's like something that you have that control over, right? So it's okay. We're not always expected or have to be our authentic, vulnerable selves to the whole world, but who are these safe spaces and safe people where I can show up and be me and be accepted? So it sounds like
Hmm.
that's something you've been working on. I love that. Love that for you.
Yeah. Yeah, because I have to, because if I'm low energy, then I'm not going to be my authentic self. I want to be that cranky 5-year-old or that cranky toddler, and that is not who I am.
That's literally me after one night of not sleeping well. So
Yep.
I feel that. Well, thank you so much, Rainey. I so appreciate our conversation. I got to learn some things, and hopefully some other folks did as well. So thank you so much for being here.
Yeah, it was so much fun.
Yay. All right, folks. Well, until next time, take care of yourselves and each other, and remember that the world needs the real you. So let's explore that authenticity together.